Cruel world. My name is Dr. Shaham Das. I'm a consultant forensic psychiatrist. I assess mentally disordered offenders for a living so that you don't have to. Okay, so I came across this video by the infamous Jordan Peterson, and it's about his advice for people with depression, and I thought I have to make a reaction video to this. I want to give you my thoughts, my insights. So as a psychiatrist, I've assessed dozens, hundreds of people with depression. Potentially I'm coming at a slightly different angle from Jordan Peterson because I'm a psychiatrist, a doctor first. Generally speaking, it's a bit simplistic, but generally speaking, we tend to medicate, whereas psychologists tend to do talking therapy. As I said, that's a bit reductionist, but that is a broad difference between psychiatrists and psychologists. Other difference between me and Jordan Peterson is that he has 7.74 million subscribers on his YouTube channel, and I've got 7.74 million less than that. Okay, so in this video, I'm going to analyze his video, and I'm also going to tell you 5 reasons why Jordan Peterson is so controversial, why he's on the edge of being cancelled. Just very, very briefly, in case you don't know, in 2022, the College of Psychologists of Ontario began proceedings against Peterson's license due to his social media conduct and his tweets, which they deemed to be unprofessional. Jordan Peterson appealed, but that was denied. And part of the conditions is that he has to do extra media training. So his license technically is under suspension right now, and he's technically suspended right now. It doesn't necessarily mean it's going to be revoked, but that's what it is looking like. But anyway, let's get into it. Let's play the video, and I'll tell you my thoughts.
The first thing I would say is that if you're dealing with someone who's depressed and they're really depressed, you should try giving them antidepressants, because if they die, you can't help them. Okay, so if you're suffering, you are obligated, in a sense, to hold on to whatever rope someone throws you. And one of the things I do with my clients all the time, especially if they're really in trouble, is to tell them, look, I don't know exactly what's going to help you, but don't arbitrarily throw out any possibilities because you might not have that luxury. Antidepressants help a lot of people, and there are technical reasons why that's the case. So that's a simple answer. It's not relevant to what I already described, except that if you're offered a gift by your society and it works, try it. I don't care what your presuppositions are.
Yeah, so right off the bat, I have to say I'm a little bit surprised that the first thing that Jordan Peterson's talking about is about antidepressants, again, because he's a psychologist. So I guess the obvious big question you're probably thinking is, are antidepressants reliable? Are they effective? And that is a huge question. And it's actually quite difficult to answer in such a short video like this, even for an intelligent, handsome, gold-toothed forensic psychiatrist who never skips leg days. Plus, I'm still sort of holding out to the chance that a pharma company might take me on a worldwide cruise. So if you're listening, Mr. Pfizer or Johnson or the other Johnson, slip into my DMs and let me know. Now, I'm being facetious. Basically, to summarize, studies show that antidepressants can be effective, but they're more effective for the severe end of the spectrum of depression. So, for example, they're definitely better than placebo at treating moderate depression. And on average, studies have shown that people with that kind of severity have a reduction in depressive symptoms compared to taking placebo. But, and here's the important bit, the effect size is quite moderate, which means it doesn't get rid of your depression. It just kind of dampens down some of the symptoms a little bit. So around 40 to 60% of individuals with moderate depression show a significant improvement when taking antidepressants, whilst others either have no improvement at all or only a tiny bit of improvement. And also, antidepressants are not particularly helpful for mild depression. In fact, you've probably heard this, my Psych for guys, and I've definitely seen it in my clinical practice. Sometimes, if people have mild depression, their depression might actually get worse because they become more agitated, and there might even be an initial increase in risk in suicide. Now, they say that if you stick with it long enough, then you get the improvements after 4 to 6 weeks. But if you're already low, you're already depressed, and then you start feeling agitated, it's quite hard for people to stick to it because they don't see the benefits. And 50% of the time, it doesn't help. So, you might go through all of this torture when you're already low. For what? For nothing. Anyway, back to the video.
Apart from that, lots of the time you see people who are suffering with depression, for example. There's a multitude of reasons, but I'll take one common reason.
Sorry, I just wanted to say, can we just take a moment and a second to acknowledge the irony of a psychologist versus psychiatrist when he's saying take medication and I'm kind of being a bit reticent about it. Can we just acknowledge that? Done? Good. Okay, move on.
You can think about it as associated with the story of Peter Pan. A Peter Pan is someone who won't grow up, right? Now, the problem with Peter Pan is he gets to be king, but it's king of Neverland. Neverland doesn't exist. So being king of nothing isn't that helpful. Well, one of the things that you often see with people who suffer from depression, and I'm not making a blanket statement about the cause of depression because there's lots of them, is that people who don't have enough order in their life tend to get overwhelmed. So, for example, if someone comes into me and to see me and they say they're depressed, I always ask them a very standard set of questions. Do you have a job?
Wait, hang on. I'm going to come on to the job because I think that's another important point. But sorry, maybe I'm not quite as intelligent as Jordan Peterson, but I did not get that Peter Pan analogy at all. The king of nothing, being the king of nothing. So what does that mean? What does that mean? I'm sorry. If you understand my Schmeichel guys, explain what he meant, because that just kind of flew over my head, much like Peter Pan.
Have a job, you're really in trouble in our society. First of all, your biological rhythms tend to go off the rails right away because there's no reason to go to bed at any particular time and there's no reason to get up. And for many people, if they don't get up at the same time, they foul up the functioning of their circadian rhythms, and that's enough to make them depressed right off the bat, especially if they start napping during the afternoon. They also don't have a purpose. People aren't good without a purpose. And this isn't hypothesizing. We absolutely understand the circuitry that underlies positive emotion. We know how it works. Almost all the positive emotion that any of you are likely to experience in your life will not be a consequence of attaining things. It will be a consequence of seeing that things are working as you proceed towards a goal you value. That's completely different. And you need to know this because people are often stunned, for example. They finish their PhD thesis and their presupposition is that they're going to be elated for a month. And often instead, they're actually depressed. And they think, what the hell? I've been working on this for 7 years and I handed it in. And what do I do now? And that's...
Okay, so he makes a couple of very good points here. I suppose just straight off the bat, when I listened to that, I was thinking of Tyson Fury. So I'm sure you guys know who he is. If you listen to his life story, he, had this goal of becoming a heavyweight champion of the world. Trained really, really hard, went through all this torture and pain to get there. And when he got there, he was actually really depressed. And that's when he started binging on cocaine, had problems with bipolar, got depression and blah, blah, blah. My point being, this is exactly what Jordan Peterson's talking about. Sometimes it's the journey, I guess, rather than the destination. Sorry, that sounded a little lame, but you know what I mean. Okay, so what are my thoughts on what Jordan Peterson's saying about work? So he's basically he's saying that if you don't have a job, then your life can be chaotic. It might lack structure, it might lack purpose. And that's a very good point. It's a very good point. And I think he's explained it very eloquently. And he's also saying that a job can give you a routine. But to throw a hammer into the works, to put a butterfly into the ointment, I'd also say that in some cases, from my experience of treating patients, a job can actually be damaging. And I'll explain why. Because if you're depressed, especially at the more severe end of depression, you might struggle with concentration, with focus, with energy and motivation. These are well-known somatic symptoms, so physical symptoms of depression. Your functioning might decrease at work, so you might not be as good at your job because of all of those things I mentioned, energy, motivation. You could be criticized by your boss. You could be bullied by your colleagues. So what I'm saying is it's possible in the right set of circumstances that having depression and going to and working can actually make things worse for you. So just to be pistol clear, I'm not talking about just people not enjoying their work, because that's very common. I'm talking about actual symptoms of depression causing this kind of negative cycle of poor self-esteem. So I suppose, even though I kind of agree with what JP is saying, I also think that in some cases it's a bit simplistic. It kind of depends on the circumstances and the mental fragility of the individual. I think that's fair to say. Okay, whack the video.
Depresses them, right? It's the what do I do now? Well, they're fine if they enjoyed it, pursuing the thing, as long as it was working out. They get a lot of enthusiasm and excitement out of that, because that's how our nervous systems work. Most of your positive emotion is goal pursuit emotion. If you take drugs like cocaine or amphetamine, the reason they're enjoyable is because they turn on the systems that help you pursue goals. That's why people like them. So if you don't have a job, you got no structure, that's not good. Plus, you tend not to have a point. So you're overwhelmed by chaotic lack of structure and you don't have any positive emotion. Well, do you have any friends? So sometimes you see people who are depressed, they have no job, they have no friends, they have no intimate relationship, they have an additional health problem, and they have a drug and alcohol problem. My experience has been if you have 3 of those problems, it's almost impossible to help you. You're so deeply mired in chaos that you can't get out because you make progress on one front and one of the other problems pulls you down. So one of the things I tell people who are depressed is don't sacrifice your stability. Get a job, even if it's not the job you exactly want. Get a damn job, you need a job. Find some friends, get out in the dating circuit. See if you can establish an intimate relationship. Put together some of the foundational items that are like pillars that your life rests on. Well, that's the practical thing to do. So that's one example.
Yeah. Again, I agree in theory what Jordan Peterson is saying, and I suppose the reason I'm being a bit reticent, I don't mean to be negative, I'm not just trying to make this video to criticise him, because I actually think a lot of what he's saying is very valuable. But I suppose I think that you need to put it into context. It's different for different people, is what I'm trying to say. So I've definitely seen some people who have a decent support structure and they have the opportunities to socialize if they want, but because of their depression, they have other typical symptoms like being withdrawn, being isolated, feeling anhedonia, which is we psychiatrists like to sound cleverer than we are, so we call things Latin for no reason. Anhedonia is a lack of pleasure in previous activities like socializing. So for those people, I agree with JP, they need to get out there. However, this advice is not helpful for people who lack this social structure. So if you don't have friends, say you just struggled in your adolescence, or you've moved to a new area, you've got poor self-esteem, you've got self-doubt, you've got low confidence, then I don't think that advice is particularly helpful, even though it's coming from the right place.
With regards to depression. Well, the thing is, you don't just launch it on them, you got to negotiate with the person, and you also got to teach them to negotiate with themselves, and this is something that's very useful to know. You can tyrannize yourself into doing things, but I wouldn't recommend it. What I would recommend instead is that you ask yourself what you're willing to do. It's a really effective technique. It's like a meditative technique. So, for example, you can get up in the morning and you can think, well, I'd like to have a good day today, so I'd like to go to bed tonight without feeling guilty because I, didn't do some things I said I was going to do, and I'd like to have kind of an interesting day. So you got to fulfill my responsibilities, and I want to, enjoy the day. Then you can ask yourself, well, okay, what would I have to do in order for that to happen that I would do? And the probability, if you practice this for 3 or 4 days, is your brain will just tell you, it'll say, well, there's that piece of homework that you haven't done for like 3 weeks. You should knock that sucker off because it would only take you 10 minutes and you've been avoiding it and torturing yourself to death for, like 72 hours straight. And if you do that, here's a little interesting thing you can do. And, maybe this is a little obligation you should clean up. And so what you do in a situation like that is you teach the person to negotiate with themselves. Say, well, let's figure out what your aims are. You got to have some aims, whatever they are. And they might say, well, I'm so depressed I don't have any aims. And then I say, well, pick the least objectionable of the aims and act it out for a while and see what happens. Because sometimes your emotional systems are so fouled up that you have to pretend, you have to act the thing.
I'm kind of smiling there because I like the way that in this video obviously is not made by Jordan Peterson, it's by Motivation Arc. But yeah, so I like the way that he's talking about aims, and the video just thought, how do I express somebody having an aim? I know, how about aiming an arrow at an apple? Pretty on the nose, but sorry, that amused me. Let's continue.
Before you can start to believe it. I mean, people always assume they have to believe and then act, but sometimes that's true and lots of times it isn't. So the trick, if you're doing therapy.
Also, I know I just talked about Tyson Fury, but for the average person, why is boxing, sparring part of their aims? I think that's probably quite low down on the list of people who are suffering from depression. Just
work with somebody and you're helping them establish a structure is to find out what they'll do. Now, if they want to get better, which is not a given, because there are often payoffs for not getting better. That's basically the payoffs of being a martyr, or maybe the payoffs of doing what your entirely pathological family members want you to do because they actually want you to fail. Assuming you want to get better, there's usually something you can figure out that would constitute a step towards some sort of concrete goal. And my presumption, it's a behavioral presumption fundamentally, is that small accruing gains that repeat are unbelievably powerful. So,
yeah, I just commented on that. I'm assuming this video is from a long time ago because his hair is brownish rather than grey. I actually, even though I'm being a bit facetious about some of the stuff, I actually think he's making an extremely good point here, Jordan Peterson, which is basically this. If you're treating somebody, giving them therapy, you have to negotiate what is realistic, what they can achieve. So if you as the therapist go and say you should achieve X, Y, and Z, eat less sugar this week, don't binge on takeaway food, go for a walk, blah, 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 but the person's not really feeling it, they don't feel themselves that motivated to do it, then you're wasting both of your time. You could even make them worse because, as JP was saying, it can even lower their self-esteem even further because they're not achieving these small goals. So you need to negotiate, and you need to get the person to negotiate with themselves. And I'll be honest with you here, I'm going to fully admit our flaws as psychiatrists. I don't think we're well versed at doing this because at medical school, in our psychiatry training, we're taught all the practical steps, and it's kind of like, you're the doctor, make the patient do it, enforce them all. We're not actually taught about how to negotiate and how to come up with a realistic structured plan. So JP makes an extremely good point. I also would make the point that generally psychologists sit down and have talking therapy with their patients compared to psychiatrists. They have more time per patient. So psychiatrists see a bigger caseload, so they'll treat more people, but a bit like your GP, they'll see them occasionally and give them medication often, whereas a psychologist will sit down with you, ask you about your mother, etc. So they have longer time to like come up with a management plan with their patients. Anyway, continue.
You know, and this is another thing to know about in your own life. It's something I learned in part from reading the writings of Alexander Solzhenitsyn, who's a great Russian philosopher and novelist. You know, he said, you can look at your life and you can see what isn't right about it. I mean, all you have to do is look. And then you can start to fix that. And the way you fix it is by noticing what you could, in fact, fix. You know, people are often trying to fix things they can't fix, which I would not recommend, because if you try to fix something you can't fix, you'll just ruin it. Like, you can find all sorts of undergraduates who are perfectly willing to restructure the international economic system, who cannot keep their room clean. And there's actually a gap there, you know, which...
Hang on a second. I can't restructure the economic international system, and I can't keep my room clean. So what does that make me?
It's surprising that people don't actually notice. So I would say, if you pay attention, you can see things that you could fix. They yell at you. They really do. We even know how that happens. Let me give you an example. Because rooms are full of stories. And the stories have effects on you. So here's a classic experiment. So you take two groups of undergraduates, you bring them into your lab, and you give one group a multiple choice test that has a bunch of words in it that are associated with being old. And you give the other group the same multiple choice test, except the words are associated with being young. This is independent of the content of the test. It's just descriptions. And then you time the undergraduates as they walk back to the elevators. The ones who completed the multiple choice test that had more words associated with aging walk slower back to the elevators. And they don't know that. And they don't know they're doing it. And that study's been replicated in various forms many, many times. So you're unbelievably sensitive to the story that your environment's telling you. The environment is not made out of objects. That's just wrong. Your environment is basically made out of something like tools and obstacles. You're a tool-using creature. You're a tool-perceiving creature. The things...
That's actually really interesting. So I've not heard of that study. I mean, I believe him because, you know, he's a very credible guy. But it does sound quite far-fetched that would actually happen, that even the questionnaire would slow down your mood or affect your mood to the degree that you actually walk slower to the elevators. So anybody or my Psych guys, if you know about that study, please let me know details, put the links, etc. I'd love to read it. I'm skeptical, but I also believe him at the same time. Why would he lie?
It's like if I take you out of this room and I say, well, what was in the room? You're not going to say, random patterns in the carpet, because they're real. They're just as good an object as anything else. You're going to say chairs because you can sit on them, and you're going to say handrails because you can hold them. You're going to say stairs because you can walk down them. That's what you see, and that's what you interact with. And if you pay attention to your environment, which is you, by the way, extended, all of your experience is you. It will tell you all the time what you should do. All you have to do is do it. But then you have to decide if you want to do it. One of the things I've noticed about people, because I've wondered, once I started studying these mythological stories, and I got this idea about the fact that life can be meaningful enough to justify its suffering. I thought, God, that's such a good idea. Because it's not optimistic exactly. You know, some people will tell you, well, you can be happy. It's like, those people are idiots.
I'm a little bit confused about what Jordan Peterson's going on about now. Are you okay, JP? What's going on? It's not really advice for people with depression. What are you talking about?
Telling you, they're idiots. There's going to be things that come along that flatten you so hard you won't believe it. And you're not happy then. And so if life is to be happy, well, in those situations, what are you doing? Why even live? But life isn't to be happy. If you're happy, you're bloody fortunate, and you should enjoy it. You should, because it's the grace of God, so to speak. With regards to meaning, I thought, well, people know when they're doing something meaningful. They can tell. So why the hell don't they do meaningful things all the time? It seems obvious. You could do it. I mean, it's hard, because other people want you to do other things, and it's a struggle, but everything's...
Just so you know, if you're thinking about meaningful things, then, as we all know, drawing circles, perfect circles with a compass, making a guitar from scratch, I believe. These are all very meaningful activities, just in case you were wondering.
Struggle. And then I thought, well, I get it. I see why. It took me about 10 years to figure this out. People have a choice. Choice number one, nothing you do means anything. Well, that's kind of a drag, right? It's meaninglessness of life and all that, existential angst. That's kind of a pain. But the upside of nothing that you do is meaningful is you don't have to do anything. You've got no responsibility. Now, you have to suffer because things are meaningless, but that's a small price to pay for being able to be completely useless.
Again, I'm a little bit confused about what JP's going on about here. It seems quite philosophical. It's not particularly helpful for somebody with depression. I don't know what he's talking about. Sorry, JP.
The alternative is everything you do matters. Really. If you make a mistake, it's a real mistake. If you betray someone, you tilt the world a little more sharply towards evil rather than good. It matters what you do. Well, if you buy that, then you can have a meaningful life. But there's no mucking around. It means responsibility. It means that the decisions you make are important. It means that when...
I don't know, like with respect to JP, that seems a bit simplistic to me. It's a bit like what we call in psychological terms black and white thinking. Things are, there's no grey areas. Things are very simplistic. It's a bit reductionist. It's a bit catastrophic thinking as well, like assuming that it's either this one reasonable thing or absolute disaster. I mean, JP's a clever guy. I'm sure he appreciates that most people don't think that it's one of those two extremes. Most people will know that some of what we do is really sort of meaningful and important and can change our lives and is long lasting. Everybody knows that some things that we do are just pleasurable. They give us temporary well-being, not necessarily good for you psychiatrically or physically, but they just give you temporary pleasure, like donuts or crack. So I'm not sure that I agree with him in this bit. I think he's being a bit, I don't know, maybe I'm missing something, but it seems a bit reductionist.
Do something wrong. It's wrong. Well, do you want that?
Oh, that's it. Didn't realize it was going to end so suddenly. Okay, so I will tell you my overall thoughts about this video. To conclude, to summarize, I mean, I'm a bit surprised. It doesn't seem very comprehensive. For example, Jordan Peterson briefly mentions medication, but in quite a narrow context. It doesn't talk about some of the most obvious ways to help treat depression or improve your mental health: therapy, exercise, subscribing to my YouTube channel, healthy eating, meditation, especially therapy. It surprised me that JP didn't talk about therapy because he's a psychologist and that's surely his bread and margarine. However, to be fair, I might have been taking this video out of context, that it might have been part of a larger conversation, and maybe this person just clipped up this little bit. If you know my Psych for Sore guys, let me know in the section below. I do have to say, I think he went a little bit off the rails at the end. It just seemed a little bit, I don't know, a bit kind of philosophical, depressive himself, a bit kind of negative. Are you okay, JP? Reach out to me if you're not. Okay, so I'd like to move on to the second part of my video, which is, why is Jordan Peterson so controversial? Why is he potentially on the brink of being cancelled? So I did mention before that his license is currently suspended and might be revoked. So here are the 5 reasons why Jordan Peterson is so controversial. Number 1, probably the biggest one, gender. So he expresses views on gender roles and transgender identities that some people in the past have considered to be transphobic, discriminatory, and he's often debated them publicly. And I think there's people who've walked out of his lectures, etc., etc. And look, I'm not picking sides. I don't want anyone to think anything I'm saying is transphobic. I think I'll hold on to my career, thank you. But my understanding is that what he was trying to say is that he doesn't have a problem with trans people changing their pronouns, but he has a problem with him being forced to accept those pronouns. So if I'm right, let me know in the comment section below. If I'm wrong, also let me know. Please don't cancel me. By the way, there's a video that I've done on my channel with Jordan Peterson's interview with Kathy Newman, and it is very entertaining because she is quite acerbic, and he just takes her apart. I'm sure you've seen that video, see my thoughts on it in my video. Always be plugging. Number 2 reason I think why Jordan Peterson is so controversial is free speech. So he strongly advocates for free speech, even if it's offensive or controversial, and some people think that or perceive that as him supporting harmful discourse, hate speech, etc., etc. Number 3 reason why I think Jordan Peterson is sometimes controversial is because of his political views. So he's often described as quite conservative or right-wing, and he's been criticised of promoting his kind of traditional views and social inequalities into some of his psychological speech. Number 4 reason why I believe that Jordan Peterson is controversial is because of his religious views. So his integration of religious themes and interpretations into his psychology and philosophy, and some people think that that's just a bit offensive and a bit inappropriate. My 5th and final reason why I think Jordan Peterson is often controversial is because some of his scientific claims about psychology, biology, other fields have been disputed by experts. And I suppose he's thought of by some people in the scientific community of being a bit of a jack of all trades, master of none. So he talks about so many different topics. And I think he talks about a lot of them very sensibly and very eloquently, but not all of them. And I think that there's some people that think that he spreads himself too thin, so he talks about things that are not really his area of expertise, like philosophy, for example. So a lot of people think that if you've got an opinion on so many things, you can't study them all. So, you know, a lot of the experts in those fields probably, if I'm honest, they're probably feeling a little bit stung that they're not being asked for opinions, maybe. Is there a bit of jealousy? Is that fair? But there's been criticisms from experts, not from the layperson, because the layperson wouldn't know if what he's saying is accurate or not, but from experts in that scientific field. Anyway, I've rambled long enough. My Psych for Sore guys, let me know your thoughts on Jordan Peterson. Do you think he's an intelligent dude who's getting scapegoat? Is he a victim of cancel culture, or is Jordan Peterson a spawn of the devil? Let me know in the comment section below. Have a blessed day. That's enough from me. Watch the rest of my goddamn videos, buy my book, and do not forget, I love you.